While the quadriceps are knee extensors, the hamstrings, located back here in the posterior compartment, are knee flexors. Now, the knee can flex and extend, but it can also slightly externally rotate in this terminal knee extension position, but we're going to consider that pretty trivial. So we're just going to say that it flexes and extends, and we're going to quickly review the muscles that allow it to do so. So starting off with the quadriceps, you guessed it, there's 4 of them, and we have this special muscle that crosses 2 joints called the rectus femoris. It is, as I said in the last video on hip musculature, it is a key hip flexor, but of course, being a quadriceps muscle and eventually merging down into this quadriceps tendon and patellar tendon down here, it will be a big-time knee extensor as well. So if we take off that first of the 4 quadriceps muscle, we then reveal the 3 vastus muscles, 3 large muscles. All of these muscles are going to attach to the femur, not the hip. Okay, it's not going to attach to the pelvis. These are all going to attach to the femur. We have the most laterally located one called the vastus lateralis, and then we have the vastus intermedius, which is located deep to the rectus femoris and in between the vastus lateralis and the vastus medialis, which you can see is located right here. So, as you can see, all 3 vastus muscles are located. They just cross one joint. They're going from the femur down, merging into this patellar tendon, and going on to the tibia located. They're inserting on that tibial tuberosity on the anterior side. All right, so that leaves us with the hamstring. So we see here that the hamstrings aren't the only muscle that crosses the posterior side of the knee. We also see the gastrocnemius here. So let's take a look at this gastrocnemius from the posterior side. Here's the the medial head of the gastrocnemius, and then here's the lateral head of the gastrocnemius that makes up the posterior compartment of our lower leg. And you can see that these actually are crossing the knee. Okay, they're eventually going to merge down and form your Achilles tendon along with the soleus and plantaris muscle, and this Achilles tendon is going to allow us to do some plantar flexion. However, it is notable that it crosses the knee joint. So when we perform knee flexion, it's not just the hamstrings that are involved, it's also the gastrocnemius. In fact, if we take a look at knee flexion, these are the muscles that are involved. Notice that we have our hamstring muscles located up here. We'll name them shortly. And then also the muscles of the lower leg, the gastrocnemius. All right, so enough of that. Let's review our hamstring muscles. We'll start off right here with the semitendinosus. Semitendinosus will attach medially. Underneath the semitendinosus will be the semimembranosus, also attaching medially. So we have 4 in total. Those are 2. If they begin with semi, that means they must be attaching medially and they must be a hamstring muscle. On the other side, on the lateral side, we have the long and short heads of the biceps femoris. Here's the short head underneath. Let's look at where this is located. Okay, short head of the biceps femoris. Notice that this one does not cross the hip. This one only crosses the knee. The long head of the biceps femoris will cross the hip. So of the hamstring muscles, 3 of them end up inserting on this, on the ischial tuberosity crossing the hip joint. One, the short head of the biceps femoris will not. Okay, short head will not. All right. So there are your hamstrings: biceps femoris, long and short. Oops, and short, and then semi-tendinosus, semi-membranosus on the quadriceps. We have our rectus femoris shown on this side, crossing two joints, and the rest do not. The vastus muscles, lateralis, medialis, and intermedius.